Hello, and thank you for being part of the Wayne State University Mortuary Science Program's Funeral Service Educational Team. Your participation in our students' education is vital to their success and to enhancing professionalism in funeral service. I'm Mark Evely, Chair of the Department of Applied Health Sciences and Program Director of Mortuary Science at Wayne State. This video series is designed to provide answers and guidance to you, our preceptors. In this video, we'll discuss the approaches to embalming for students and the preparation for clinical tasks. It cannot be overstated that the preceptor's role in embalming instruction is essential. You and your team can help to make a strong and lasting impression on a student's educational experience in this single area. We encourage you to allow students to perform as many embalming steps as possible while you're observing and instructing. Students will have the most optimal learning potential through this approach and have the potential to become skilled embalmers over time. Here are a few more ways that preceptors can help students gain the skills they need. Allow students to set features. While sometimes the case may dictate the amount of involvement, be sure to let them attempt this important aspect. Let students prep the room for the embalming to take place. This can include setting out the fluids to be used and noting how much of each fluid is needed in the solution and why each chemical is used. Try to analyze whether their thought process is correct in selecting the fluids. Allow students to make an incision and raise the vessels. If they have difficulty, you can raise, then replace the vessels into the incision without ligature, then ask the student to raise them. This allows for the student to learn by doing. Under your direct supervision, allow for the student to aspirate. Let students perform all the functions of initial and terminal disinfection. And be sure to read and sign off on each embalming report.
Well, I really liked all three of my placements because they were so hands-on with me. One of the first things the director said to me my first day of practicum was, don't worry, there's nothing that you can do that I can't undo. So that really gave me a, kind of more of a sense of peace, that knowing that there's really not a whole lot I can screw up and that they have my back, and that, they really let me do things myself while they're still watching, they're guiding me through it. But you get a lot more experience doing it yourself than you do just watching someone do it.
Reading from a textbook versus actually seeing it, especially with something like embalming, that is hands-on 100%. And you read things in your textbook and you even just hearing, different names of different instruments and things like that, seeing those things in person really ingrains it in your brain, and you're able to, use those skills that you learned in the classroom and apply those hands-on. So it's a really cool experience.
Next, let's run through some steps you can allow students to handle in the preparation room. Have the student verify that permission to embalm or perform restorative art procedures has been secured. Explain how to follow universal precautions according to the bloodborne pathogen standard and OSHA requirements. Show how to properly select and apply appropriate PPE. Allow for students to assist in verifying the identity of the deceased prior to the start of preparations. Allow for students to observe and, whenever possible, to assist with the following steps: selecting the appropriate chemicals and applications, selecting the appropriate instruments, performing a pre-embalming analysis, setting features, applying topical disinfectant, raising vessels for drainage, performing arterial injection, shaving the deceased, bathing the deceased, aspirating the deceased, adjusting the pressure and rate of flow of the embalming machine, treating bruises, lacerations, or other trauma present, treating special cases such as autopsies, infants, and donors, and completing the embalming report.
I really enjoyed my practicum experience. I got placed at 3 different funeral homes, one each semester. Each one was better than the last. Everyone there, super supportive, very hands-on with me, wanted me to actually do things and not just watch them do things. In the end, I think I ended up embalming with 12 different funeral directors, so I got to see a lot of different methods, a lot of different ways to do things, figure out what I like, what I didn't like, and figure out a way that's my own.
Thanks again for taking on this important role as a preceptor in the Wayne State University Mortuary Science program. If you have additional questions about clinical programs and the role you play as a preceptor, reference the Wayne State University Mortuary Science Practicum Manual, or contact Practicum Coordinator Lauren Budrow or me, Mark Evely, via the information you see here.